This morning we presented on behalf of the group the results of the induction phase of this trial, which is a trial for first-line CLL patient without TP53 alteration. As you know, for this patient, FCR is gold standard with the correlation you can get between MRD and survival. And recently we have a lot of new drugs, including Ibrutinib, targeting BTK, and GA101, which is a class 2 CD20 antibody. So the idea of the group was to build a chemo-sparing strategy by starting by 9 months of the association of GA101 plus Ibrutinib. And for patients in CR, according to ICLL criteria, plus undetectable bone marrow MRD, they received 7 months of Ibrutinib until the endpoint at month 16. For the other one, PR or positive MRD, they received 4 cycles instead of 6 cycles of GA101 FC plus Ibrutinib. So this morning I present the final results of the initial phase, the 9 months of the association of GA101 and Ibrutinib. So we've got 135 patients. 130 were evaluable because 2 patients died from sudden death and from domestical fall, and 3 patients did not receive treatment because at the beginning they have cardiac problems or infectious problem. So 130 patients were evaluable. The overall response rate is 100%, which is quite similar to the other trial. We have 43% of CR according to ICLL, which is quite good results, similar to what you can get with 6 cycles of FCR, for instance in the CLL11 German trial. But we have only 13% of the patients who were bone marrow negative, MRD negative into the bone marrow and PB. So the majority of the trial of the patients received 4 cycles of GA101 FC. But the toxicity was quite good, with 90% of the patients receiving GA101, all the cycles, and only 15 patients decreased or stopped Ibrutinib, mainly because of cardiac toxicity, 2 out of 3, and 1 because of cytopenia. And the main grade 4 and 3 side effects were related to infusion of GA101 and hematological toxicity. So to summarize the trial, the first part of the trial, it's feasible without big toxicity, with a good response rate, with a very good CR response rate according to ICLL, but only a small percentage of these patients were negative for MRD. So we are waiting for the final data after 4 cycles for the majority of the patients, and we hope to have this data for the next ASH meeting.